Welcome to Group 9's presentation, and today we're going to be discussing the reliability and validity of the floor transfer test as a measure of readiness for independent living among older adults. Presenting with me today will be Ariana Gardner, Katie Pratt, Anna Little, and Adam Livingston. So to start off, I'm just going to clarify a couple of our abbreviations used throughout our PowerPoint. So FT is going to stand for floor transfer. PFS means physical functioning subscale. PPF is phenotype of physical frailty. SPPB is short physical performance battery, and PI is principal investigator. So going into our background, the ability to get up and down from the floor safely or perform a floor transfer is a critical skill for functional independence. 1 in 3 community-dwelling adults 65 years of age or older fall each year, and about half of them suffer from multiple falls. Obviously, these older adults who fall must be able to get up from the floor, but about 47% of those adults are unable to do so without any assistance. So the inability to perform a floor transfer could be an indicative or decreased mobility or physical disability. The floor transfer test is a quick and easy way to help identify older community-dwelling adults who may benefit from physical therapy intervention to promote functional independence. The floor transfer test can be used in a clinical and/or home care setting by both clinicians and researchers to determine a patient's ability to safely and successfully get up and down from the floor. Our study had 4 main goals, and they were to assess the inter-rater reliability of principal investigator for measuring outcome variables, to determine concurrent validity of floor transfer test against various questionnaires. Those questionnaires included physical functioning subscale of 36 items short form health survey, the floor transfer questionnaire, the phenotype of physical frailty, and short physical performance battery. It was also used to determine known groups' validity by assessing if the floor transfer test can distinguish between older adults with or without disabilities and functionally dependent and independent. And it was also used to provide descriptive data for the 3 outcome levels of the floor transfer test. These outcomes can be independent, assisted, or dependent, as mentioned above.
All right, so I'm going to kick off our methods here. Our study was a cross-sectional study involving 61 community-dwelling older adults. Their ages range from 65 to 96. And they were divided into 2 groups. Our first 15 participants were used to study the intra-rater reliability, and the other 46 participants were used to study concurrent validity. All the participants self-ranked their floor transferability as independent, assisted, or dependent.
There were 2 conditions for performance of the test. In Condition 1, participants watched a video about how to perform the FT test with the utmost safety and efficiency, and then performed the test in the way that was easiest and most comfortable to them. In Condition 2, participants watched a video to familiarize themselves with a modified condition, and then performed the test with the use of a chair for added balance and safety and stability. Only 1 trial was allowed for each condition to prevent participant fatigue. A score of passing was achieved if the participant was able to lower to the ground and rise again without stumbling or having to reach out for balance. Failure meant an inability to complete the test due to fear or stumbling and loss of balance. Participants were graded as independent if they passed under normal conditions, assisted if they passed under the modified conditions, or failed if they failed under modified conditions. Inter-rater reliability of the principal investigator was assessed twice, and their scores were analyzed. Concurrent validity of the floor transfer test was compared against various physical status measures, which included the self-reported floor transfer ability questionnaire, the physical functioning scale, the phenotype of physical frailty, and the short physical performance battery. Validity was tested between the known groups by determining whether the floor transfer test distinguished between participants with physical disabilities and those without physical disabilities, and participants who were functionally dependent or independent. For assessment of the inter-rater reliability of the principal investigator, a score of at least excellent was obtained on every physical status measure except for the self-reported floor transferability questionnaire. A likely cause of this is that some participants changed their self-reported ability after they actually performed the test. Overall, these scores indicate that there was little variation between the 2 tests, and thus inter-rater reliability was established. Concurrent validity was also established. Significant positive correlations existed between the floor transfer test and the other outcome measures. The highest correlation was between the floor transfer test and the self-reported floor transferability questionnaire, meaning that most of the participants could correctly identify their ability to perform the FT test. There was a significant difference between the floor transfer test and the physical functioning scale, meaning that participants who were graded as independent did not have physical disabilities, and those who were graded as dependent had existing physical disabilities. There was also a significant difference between the floor transfer test and the short physical performance battery. Older adults who passed the floor transfer test were functionally independent, while those who failed were functionally dependent. Another interesting note is that marital status significantly differentiated the participants. Married persons were much more likely to be graded as independent than their widowed counterparts, who were likely to be graded as dependent.
So for the discussion, the principal investigator had good intra-rater reliability for almost all of the variables, and that suggests that the test protocol was persistent, reproducible, and reliable. The results also indicated that the floor transfer test was valid in screening for physical disability, frailty, and functional mobility in the geriatric population. The floor transfer test also accurately distinguished between functional independence or dependence and those with or without physical disabilities. So during this project, first and foremost, we learned what the floor transfer test is. We also learned that it's a quicker and easier way to assess the physical abilities of the geriatric population compared to other outcome measures. We also learned that it can be used in a variety of settings like inpatient, outpatient, or a patient's home. We also learned how important it is that our patients are well equipped to return to independence to make sure we help prevent future injury.
Clinical inclusion of the floor transfer test in the initial patient evaluation may help address the safety concerns of many older adults and reveal underlying conditions that could also be addressed. The floor transfer test is a simple, safe, and practical tool that physical therapists can apply easily and quickly when evaluating and rehabilitating geriatric patients. It allows physical therapists to apply the tool in the home or clinical environment effectively when screening for disability, frailty, safety, and functional mobility. It will also help expand our scope of assessment as well as reduce the burden of having to administer a lengthy assessment test.